Good evening, everyone. This is Emily. We're so glad you guys have joined us tonight, and we are so excited about what we have in store for you. Dr. Mike Apley with Kansas State University is with us tonight, and he is going to share quite a few details on the Veterinary Feed Directive. And so for those of you who aren't familiar with that, you will very soon be very familiar with what the VFD is. And so Dr. Apley is very much an expert in this field and is going to give us some great stuff tonight. The only thing I've got a reminder about is do remember that you'll have to do your write-ups on this, and they will be due a week from today, next Tuesday. And so if you're watching tonight live, take notes, and Dr. Apley will give us time at the end to ask some questions. And so take notes now, and hopefully that'll make your write-up a little bit easier. But with that, I will turn it over to Dr. Apley to give us some insight.
Thank you. Thanks for the invitation, and I'll make this slide set available to you by email. I should have done it so they could have that also to bolster their notes. The Veterinary Feed Directive is coming up very quickly, and I'm going to share my screen to see if that clicks with you. Is that there for you?
Yep, we can see it.
Perfect. All right. If at any time that changes, let me know. So the Veterinary Feed Directive starts January 1, 2017, and the whole process for this started years ago. The first time that an organized group shared some concerns about using antibiotics for growth promotion in food animals was the Swan Report, 1969, out of England. And you know, we're going to talk just about the VFD and how it's going to be put into action after the first of the year tonight. But this is one, one component of a larger concern about the use of antibiotics in both people and food animals, and how we can preserve these valuable resources for us even with the advent of antibiotic resistance. And you may have heard some of this in the news about different resistant organisms in people, and we also have our challenges with some in cattle. So the VFD goes into effect January 1, 2017, but 2012 was when we had the final guidance document that said, yep, we're asking companies to do this. Companies did it voluntarily by changing the label. So there were two things that happened at the same time, and which will phase into effect with new drug labels as of January 1. That is the removal of growth promotion uses for medically important antibiotics, and we'll talk more about those later. And then also all remaining uses of medically important antibiotics have to, in the feed or water of food animals, have to come under the direction of a veterinarian. So it's a huge change. And the new actual feed directive rule went into effect October 1, 2005. I'm moving some things around here on my screen. There we go. And the drugs that came under the VFD rule at that time were the ones which are already requiring a veterinary feed directive to be used in the feed. And that was the Palmitil, which is a feed version of Micatil, which you may have heard of or seen used in cattle or used. And there is a version of that for use in cattle and pigs. There's a generic of that that's used in swine, and there's actually a version of Nuflor, which many of you may recognize that trade name, that's used in fish, put into fish pellets or fish food for commercial applications. So those are the ones that were immediately affected. But in the beef world, since the Palmitil isn't used really widely, this is really new to a lot of beef vets, and since this is a beef cattle oriented group, I will stick with talking a lot about that. So there was some confusion about that, and those new labels are going to come into effect here in about a week or two. We'll be able to see all of the new labels for the drugs which are affected by the Veterinary Feed Directive, and these are medically important antibiotics that we use in food animals, and in cattle they would include aureomycin or Chlormax. Those are chlorotetracyclines that go into the feed. And we'll just wait and go through the list here in a minute. So a veterinary feed directive drug is intended for use in or on an animal feed, and it is limited to use under the professional supervision of a licensed veterinarian. So if it's used in or put on top of an animal feed and it is designated a veterinary feed directive drug, then it has to be authorized by a veterinarian to be used. There's only a very limited number now, but there will be multiple more after the first year. So how can you spot a VFD drug? It will say on the label, and there in yellow is the statement. It's that federal law restricts medicated feed containing this veterinary feed directive drug to use by or on the order of a licensed veterinarian. Drugs which can be used in the feed which do not require the veterinary feed directive will not have that statement on the label. So as in all uses of medications in your animals, when in doubt, read the label. And there's a lot more to the label than just what's pasted on the bottle. There's also what's called a package insert, which has a lot of really good information. And as good stewards of the animals we take care of and also of the food that they become when we sell them, it's our responsibility to do that. In the feed, they will require a veterinary feed directive if they're a VFD drug, and there's also medically important antibiotics that are in the water that will require a prescription after the first of the year. And we'll go through some drugs and then talk about you going to your local farm store and looking at these. So these are drugs that are medically important antibiotics, meaning they're very important for the use in animal or humans, and therefore they are going to be regulated in animals to make sure that we're using them appropriately. So terramycin, aureomycin, Tylan, lincocin you might recognize either if you have a swine production system or if you have show pigs, you may have feed with lincocin in it. And neomycin for cattle, we have an oral drench, but where you'd see it in the feed is in milk replacer. So this is a good time to talk about what is a feed. Feed includes the feed you'd put in the bunk for cattle, premixes that you would use to make that feed. It includes milk replacer, and it even includes milk from cows that are fed large scale to calves, so like waste milk from hospital cattle where it can't go for human consumption in dairies, or even milk that's collected from cows and then fed to other calves. Those all meet the definition of a feed. So very important to understand what feeds are. Mineral that you put out for your cattle is a feed. Lick tanks with liquid feed in them, that's a feed. And blocks that you might put out for cattle with a dewormer or maybe chlorotetracycline in it, those are also a feed. So all of those come under the guidance of this. So again, there's that list of antibiotics that are medically important that will require a VFD for use in the feed and a prescription for use in water after the first of the year. Now, it's also important to understand which drugs are not VFD drugs in the feed. So this is a list of some that aren't. And the ionophores are very commonly used in cattle. They represent about 30% by weight of what's sold every year for use in food animals. And they will be used, not necessarily these, but some others in chickens for coccidiosis control, and then you'll recognize the trade names Rumensin and Bovatec probably. Some of you may be Catalyst, as used in cattle for coccidiosis control and also to promote feed efficiency. Lasalicid also promotes, Bovatec also promotes rate of gain, where Rumensin doesn't affect rate of gain, just efficiency. Decoquinate, trade name Decox, and Corid, which is the trade name for Amprolium, those are used for coccidiosis to prevent it and Corid to treat it. And they can come in a feed version. Decox is all feed, and Corid can be an animal drench, or it can be put in the feed. Those do not require a veterinary feed directive, nor does bacitracin or mecadox, which you'd understand if you're in pigs. But for our call tonight, the ionophores are the most important ones. So those of you who are going to school your parents on this, you can tell them that the ionophores are not medically important drugs, so they won't need a VFD to feed rumensin, but if it is fed with a VFD drug, it can be fed with tylosin, then it has to be mentioned on the veterinary feed directive for tylosin. So the person who will understand all this and help you through this is your veterinarian. Your big chore is to understand which drugs you need a VFD for to go into the feed, and that you need to go talk to your veterinarian to work through this process. So here's another really, really big take-home, and that is that the veterinary feed directive is always written. It cannot be verbal. Your veterinarian can't say, sure, I authorize you to use this, here's a bag, or I'm going to call the feed store and tell them you can pick up 5 bags. It can't work that way. It's a written document that goes to you. The veterinarian keeps the original, and then the other one goes to the distributor. Here's another really, really big important thing that's world-changing for us. Read that yellow part, and we're going to mention that about 3 times. It can only be used in accordance with how it's labeled. The Animal Medicinal Drug Use Clarification Act, it's AMDUCA for short, was passed in '94, and the rules were published in the Federal Register, the regulations, in 1996. Before that, if a veterinarian were to authorize the use of any drug in food animals other than on the label, they were breaking the law, and they could only do so because the FDA wouldn't regulate. Well, if certain things were met. In 1996, we got the ability as veterinarians under specific regulations to legally authorize extra-label use, except in feed. The feed manufacturers felt that they could not handle a whole bunch of different regimens coming in. It would really upset their systems. They'd have trouble keeping it straight. So they lobbied the FDA to prohibit extra-label use in the feed, and that's what's happened. Extra-label use in the feed has been illegal easily since 1996, and technically illegal for longer than that. There's been a lot of off-label things going on out there that just haven't been enforced. Well, now everything that's authorized is going to be on paper, and all of those documents, whether it's yours, the veterinarians, or the feed distributor, those can be checked by the FDA at any time. So here's the big stressor for cattle producers, is for years chlorotetracycline has been put in the feed and mineral to treat or control pink eye and foot rot. The problem is those aren't on the label. A veterinarian will not be legally able to authorize that use, and a feed distributor will not be able to distribute drug for that purpose. So we've got some challenges ahead of us on exactly how we're going to deal with some pasture situations with pink eye and foot rot. Well, we've got vaccines that are probably partially effective, or maybe not. Well, for foot rot, they're not effective at all. And we've got some challenges. We can individually treat animals. We could go through the water, but in many pasture situations, we can't control that water source. So just be aware that foot rot and pink eye, we can't legally authorize that use, and we've got some work to do there. That definition, don't worry about. This Category 2 thing may be a little deeper than we want to go, but the Category 2 means that the most concentrated version of the drug, the type A, can only be obtained and used by a federally licensed feed mill. Some of these drugs, that's the case. For some, it's not. There's going to be some issues with the most concentrated version of aureomycin or chlorotetracycline, which we'll let lie for the purpose of this presentation, but we're going to end up dealing with that a little bit. So that's what the Category 2 feed drug means. The most concentrated form of the drug, like the 50 gram per pound aureomycin, can only be obtained by a licensed feed mill. But I really need to change that example because Oreo 50 will be a Category 1, and you won't need a feed mill license to get it. A good example would be the most concentrated version of Palmitil. So a distributor is any person who distributes that medicated feed. So your feed store or your feed mill will need to become a distributor to sell you the premixes or the final feed for you to make that feed. The type A, most concentrated versions, if you can legally buy that, they won't need a veterinary feed directive, but you need a veterinary feed directive to use it. And if that flies over some of your heads, we're still figuring that out. But the type A, most concentrated versions are medicated articles and not medicated feeds. So if you're going to pick the most concentrated versions of the drugs use, you need to be able to use them appropriately, and then you also need to be clear that even if you can buy them without a veterinary feed directive, you have to have one to use them. And this is going to be one of our biggest points of confusion as we move through this. So again, big take home tonight is you need to be talking with your veterinarian and your feed distributor about how you're going to use these things. So these are just the general requirements, and really let's consider those there for your reference that you can go back and look. There's a great page if you Google FDA Center for Veterinary Medicine Veterinary Feed Directive. You will come up with a page that has all the information on it from the FDA, and there's some great brochures on there for producers which you should download and read, and it gives you your responsibilities. This talks about the expiration date. For most of our drugs, the veterinarians should be able to authorize their use for up to 6 months. There's some that will be shorter. For example, the Palmitil for cattle is 45 days, but unless stated on the label it's shorter, it will be up to 6 months. So if you have a VFD drug you're using on your farm and the veterinarian okays it, that'll have to be renewed every 6 months. And here's just one more place in the Veterinary Feed Directive Final Rule, which this is a quote from, where it says, yep, you can't use them any other way than as they are labeled. And the medicated minerals that are out there, there are more than a few that are not approved formulations. And the reason that a mineral has to be an approved formulation is because the formulation of the mineral determines how much they'll eat every day, and how much they eat every day determines the dose of the drug. So for medicated minerals, medicated blocks, medicated liquid feeds, they have to be an approved formulation. Almost all of them have to be mixed by a licensed, federally licensed feed mill. We've used a lot of minerals out there which are not approved formulations that contain chlorotetracycline. You'll need to talk with your vet, and then you will need to ask your distributor if those are actually an approved formulation. Be prepared for a lot of confusion over that as we move into the next year. We'll get it straightened out. A lot of the companies are working very hard to get their formulations approved. So we're kind of 75% ready for this on January 1. There's a whole lot of learning curves still occurring. I answer multiple emails a day, talk at a lot of meetings, take a lot of calls, and I'm not saying that like it's a problem. It's my job, and really enjoy working with producers and veterinarians in that aspect. We're just having a lot of traffic and a lot of questions. So a lot of those questions get forwarded to the FDA. We haven't even got responses back on some of those real minor details. The FDA is going to use phased enforcement moving into next year, which means if they find someone doing something wrong, they'll educate rather than take enforcement action. They want us to learn this along with them. There's a lot of really minor points they hadn't anticipated. So it will be an interesting year. If we're all committed to working through this together, we'll get through it just fine. And that's kind of a lesson. There's a lot of things in life like that. If everyone just settles down, keeps their head, and keeps talking to everybody, usually we work through it and come out on the other side. You must retain a copy of the Veterinary Feed Directive for 2 years, whether that's electronic or manual. If it's electronic, please back up your computer. In the event of an inspection, you would be required to provide your veterinary feed directives and records of how you use those drugs. So here's things that for it to be lawful, your veterinarian has to be licensed, and they have to be licensed where the animals are. So if, for my example, I live in Kansas, if I had cows and I was using a medicated mineral on them with a VFD drug, and I had a VFD authorizing that from my veterinarian, and I decided to send them to Colorado to graze up in the mountains for the summer, and I wanted a VFD drug in them there, if my Kansas veterinarian was not licensed in Colorado, I would have to form a veterinary client-patient relationship with the veterinarian in Colorado, who would then write me the VFD for their use in Colorado. It's not about where the feed mill is or where the feed comes from. It's about where the animals are. The veterinarian has to be licensed where the animals are physically consuming the feed. And there again, one more time at the top of the screen, as a veterinarian, I can only issue a VFD for uses that are approved, and that conditionally approved or index addresses minor species. So minor species are any veterinary species other than cattle, hogs, chickens, turkeys, horses, dogs, and cats. I think I got everything in there. So minor species include sheep, goats, captive deer, chuckers, partridges, pheasants, and they don't have to be a food animal to be a minor species. So mink are a minor species. There is the provision for some limited extra label use in those minor species. You'll need to talk to your veterinarian about that if you have one of those minor species you're working with and need to put drugs in the feed. Refills aren't going to be an option because there aren't going to be any, but that's in the rule. This is about what a VCPR is. Each state has its own definition. The FDA hasn't inspected their definitions and said, yep, that's good with me. Then they have to use the federal one. The nuances of this are a little bit beyond our talk this evening, but be aware that you can't just walk into a veterinarian's office and ask for a VFD. They must know a lot of things about your animals, and these two slides talk about a real general definition of that. So what will be included on a veterinary feed directive you'll get? So here's a list of about 15 things. There will be your address, the veterinarian's address, name, your names, and then they have to list the premises where the animals are. So if you have cattle in multiple pastures and you're feeding a VFD drug and a mineral, each pasture will need to be listed on there. It can be a street address. It can be, if any of you have looked at land descriptions, it could be the west half of the southwest quarter of Section 25 in Fred's Township. It can be that, a GPS location, all kinds of things. So the expiration date is how long it's good for. You must feed the drug only when there's a valid VFD in effect. So if it's 6 months long and 2 days before that VFD's done, you decide you need to feed this drug that's fed for 10 days, you have to get another VFD. You must feed the drug for the duration stated on the VFD, and there must be a veterinary feed directive in effect while you do that. We'll be saying the name of the drug, the species and production class, so we might say beef cattle under 700 pounds, the number of animals to be fed, the indication for which the VFD is issued, and the level of the drug. That drug is always expressed in grams per ton, and your veterinarian and your distributor will need to work with you to decide how much feed can therefore be dispensed, because you'll have to say, how much are those calves eating? So say you're supplementing them with a feed and they're eating 5 pounds a day and they're going to get it for 10 days. We know the level in the feed, so each animal is going to get 50 pounds. You're going to feed 10 head. You can purchase 500 pounds of feed. You don't have to purchase it all at once, but it must be purchased while the VFD is in effect. Withdrawal time, again, reorders aren't an issue, and the veterinarian's electronic or written signature. Those are all the things that will be on there. The veterinarian can also put a more specific description, the approximate age range of the animals, all of those things, and the weight range. There's a box for added instructions. They can put those things on there. So what's this mean for you? The use of a VFD drug in the feed may be suggested by your veterinarian in response to a disease challenge. And one of those that's an example for putting chlortetracycline in the mineral is anaplasmosis. Or it may be something that you've used for quite a few years, and you're going to ask your veterinarian to authorize that as we move forward into requiring that authorization for you to purchase and use those feed drugs. Be prepared to have a conversation with your veterinarian, because I'll tell you, for example, like milk replacer, a lot of it's medicated, and it doesn't need to be. I need to have someone show me from the studies that I've looked at how it actually makes a difference in disease, other than just exposing the bacteria in that animal's gut to bacteria. So be prepared if you've been using a medicated milk replacer that your veterinarian may go, you know, I don't think you need that, and I'm on their side. And so be prepared. It's not an automatic authorization, so you're going to have a conversation. You're going to be talking about non-antibiotic alternatives. The legality, it has to match the label for dose, duration, and indication. It has to be the need for use. Efficacy, you know, does it work? Can you meet the withdrawal time? And if there's any special issues with antimicrobial resistance, your veterinarian would consider that also. So those are the things that are going to be clicking through your veterinarian's head as you talk about whether or not he or she will authorize the use of that feed drug. Again, they can only legally authorize what's on the label. So here's the difference again, and it's very important you understand the difference between an expiration date and a duration. The expiration date is how long you will be authorized to feed this VFD drug, and the duration is how long you must feed it. For some drugs, it's up to so many days, and for some drugs, it is you will feed for this many days. That's how it works. So your responsibilities are to only feed it based on the VFD issued by your licensed veterinarian. You can't feed it after the VFD expires, and you need to provide a copy of that VFD order to the feed distributor. And if they send it through you, or they may send it directly to the distributor. And you are required to maintain a copy of that VFD for a minimum of 2 years. Provide VFD orders for inspection and copying by FDA upon request. So what you'll do is the veterinarian will complete either a written or electronic veterinary feed directive form. Veterinarian keeps the original, provides you with a copy, and provides the designated distributor of the medicated feed with a copy. Those last two can be either directly or electronically. So now let's take a quiz. College professor can't resist finishing up a lecture with a quiz. So I'm going to ask you here, score yourself. Will a milk replacer with neomycin and oxytetracycline require a VFD? So neomycin and oxytetracycline are both medically important antibiotics. So you're walking down your farm supply store, you need a bag of milk replacer, you pick one up, and on the label it says it contains neomycin and oxytet. So do you require one? And the answer is yes. Those are medically important antibiotics, and the feed label, the feed tag on that bag of milk replacer will tell you that a VFD is required. What about chlortetracycline in the feed for foot rot? Will a VFD be required for that? Think about that for a second. Get ready to pinch yourself if you missed this one. And it's because it's not allowed. We talked about earlier that foot rot and pink eye are not on the label. So that is not allowed. That would be an illegal extra label use. Cannot be authorized. Even if a veterinarian wrote a VFD for that use, your distributor could not lawfully fill that, and you could not lawfully use it for that purpose. What about mineral or feed with chlorotetracycline for anaplasmosis prevention? And the answer is yes, and that is a labeled application, and the VFD may only specify those specific label inclusion rates in feed and mineral. Tylosin for reduction in liver abscesses in the feedlot. We didn't specifically talk about this, but that is, here's the hint, that is a label use of a medically important antibiotic, so the answer is yes, that requires one. Now we did talk about this one, Monensin, trade name Rumensin, as the only antibiotic that's put in the ration. Will that require a VFD? That's the theme for Jeopardy from you youngsters that may not have ever watched it. So, no, it's not a medically important antibiotic. But as we mentioned earlier, this is going to probably be fed with Tylosin in a lot of rations. And if so, on the VFD for Tylosin, the veterinarian will say, I authorize this to be fed with Rumensin. So that's how that works. And so I just answered that one, yes. So Tylosin would have to, the VFD for Tylosin would authorize Monensin. Chlorotetracycline or oxytetracycline in the feed for treatment of bovine respiratory disease. We didn't discuss this label. I also give this quiz to practicing veterinarians, so they'd be expected to know. The answer is yes. That is a legal use and a labeled use of that. So here's some common questions. Will I need a new veterinary feed directive for each pen of cattle in a feedlot or each time I pick up a medicated mineral? And the answer is no. As long as in the feedlot example, one person is the caretaker for those animals or one person is responsible, others may help. So a custom feedlot could have one VFD since they're the caretaker, and that would cover all of the pens in the feedlot if that was the number of animals the veterinarian specified for the period of the veterinary feed directive. And each time I pick up a medicated mineral, no. If you will need a VFD, but it doesn't have to be a new one. If your veterinarian authorizes you to feed a mineral that would be enough for 50 cows over 6 months, and you want to pick up enough for, you want to pick up half of that and then pick up half later, perfectly legal to do that. When the VFD expires, you may continue to possess that feed if you haven't fed it all, but you must have a VFD to feed it again. So as of January 1st, 2017, all medically important antibiotics used in the feed will require a VFD. It will tell you on the tag, and there's no legal use of those drugs other than is provided for on the label. At the same time, all medically important antibiotics used in the water will require a prescription, and the veterinarian can, under certain regulations, authorize extra label use of that. So let's think about walking down the aisle at your with the medicated feeds in it at your feed store or your farm supply store. The medicated milk replacer will require a VFD. The 4 gram and 10 gram per pound oreomycin crumbles that you can top dress or mix in, those will require a veterinary feed directive. The packets of water medication for tetracyclines and sulfas, those will require a prescription. It's a different registration for that feed store to be able to sell those. Some may choose not to sell the prescription water medications unless they want to register as drug distributors in their state and then be able to receive prescriptions. The veterinary feed directive is a much simpler, different authorization procedure. It just requires sending a letter to the FDA, so they're quite likely to continue to sell those if they want to handle the records. So veterinarians are very actively engaged with the FDA, continue to engage in training, very committed to working with their clients. And so here's a little summary about the farm supply store again. The procaine penicillin G injectable, that one you'll recognize. It's the white stuff in the bottle that you have to shake up really good. The challenge is that one will actually requires a prescription for the way we use it. The label dose is 1 cc per 100 pounds. We commonly use it at 5, and a veterinarian must by law authorize an extended withdrawal period and prescribe that treatment. Where it really get in trouble is if you had a residue from that. The procaine penicillin G will likely become prescription in the next 3 to 5 years by what the FDA says. The crumbles we talked about, those will require a veterinary feed directive. 50 gram per pound granular, that does not require a VFD to purchase, but will require a VFD to use. Once you go in the feed store to poke around, the procaine penicillin G is in the refrigerator. The long-acting oxytetracycline is on a shelf. That is over the counter. You may purchase that and use that for label indications without a prescription, but if you use it other than on the label, then you'll need a prescription for that off-label use. The water-soluble oxytetracycline will require a prescription. Viral vaccines are not drugs, they're vaccines, and they won't require any authorization at all, and that won't be changing. This type A stuff, just have that as a record. If you get in a conversation with someone, you can pull that back up. But the type A, there's some interesting things. There's also the issue where there may be more than one round of the drug given, like for the 5 days for chlortetracycline for respiratory disease in feeder cattle. And the basic rules are that you're going to have multiple VFDs to do that. And some of these are maybe, yeah, these get into some distributor things that I think we'll let lie this evening. But that was a big brain dump, and for those of you thinking about going to vet school, that's what vet school's like. That's how we crank through stuff. It is like drinking from a fire hose. And now I'll tell you that, and that it doesn't mean you can't do that. It means you need to get some really good study habits if you're thinking about going to vet school. Competitive to get in, we'd love to have you. I'm going to stop showing the screen there. There we go. But I think an hour of credit in vet school is probably like 2 hours undergraduate credit, because we get rocking and rolling and dump a lot of stuff. But questions, comments, concerns? Be glad to have a discussion with everybody.
Let me just remind the folks in the SPC a couple of ways to ask questions. You can type in a question in the question box, or you can click on the little hand symbol beside your name, and that lets us know that you have a question that you would like to verbally ask, and we will unmute you at that time. In the meantime, Dr. Apley, we've had quite a few questions going back and forth just through some text messages. And so one question that came up is whose responsibility does acquiring the VFD fall to in the instance where maybe you own a steer and you're in North Dakota, you retain ownership of that steer, but it goes down to Nebraska to be fed out? Whose responsibility is it to make sure that all the regulations are being followed?
It would be the person who's feeding out that steer. They're the caretaker of the steer, would be feeding the steer, and so they're responsible for making sure that's all done right.
Okay. And another question I guess I had was, what happens if you're not following the rules? What kind of backlash is there for people who either, knowingly or unknowingly weren't following the veterinary feed directive?
Yeah, so this first year we're going through phased enforcement, and unless you're doing something really egregious, really bad, they're going to counsel you on how to become compliant with the regulations. So really wanting people to learn and learn how to navigate it, veterinarians, the producer and the distributor. If you are if you didn't keep records, or you fed maybe a little more feed than you should have, or you didn't feed it quite right, probably the first time if an FDA inspector shows up, they're going to want to give you a letter saying, here's what we found, that things weren't in compliance. You need to write us back on how you're going to fix that. You usually have 90 days to do that. That'll probably mean they're going to come back and see if you're doing it right. And if they come back and you're not, this time it's going to be, you know what, you better fix this. If it's really bad, they could throw a padlock on your gate, no animals move until you get it fixed. Usually what will happen is they'll say, listen, last chance, you're going to fix this, we'll come back again, and if it's not fixed, we're going to fine you or do something like that. And usually what happens, if it's an honest mistake, the first time they make you aware of that, and you go, okay, we know that now, here's how we'll fix it. It's not like black helicopters are flying around looking for the opportunity. But it's, we're going to go through a pretty big learning phase, so I don't want anyone to leave this webinar thinking, oh my gosh, this is undoable, or it's just a real problem. It's some learning. A year from now, we'll have it down what we need to do, and we'll just be rolling on, except some of the uses we were used to using can't be legally authorized anymore.
Okay. So we had a question from our audience, which I think you brought up in your talk. Can a vet go into a different state and give a medication? And my understanding from what you had talked about is whether or not they're licensed in that state. Is that
if they're licensed, yes. If they're not licensed, no.
Yeah. And then another question, sorry, asking you 20 questions, but what do you think, will there be charges associated with doing a VFD? Is that going to be based on the veterinarian? Is it similar to getting health papers? How do you picture the kind of protocol and the costs associated to producers with these changes?
Just like for health papers, the cost will vary by veterinarian. Some of them will be using an electronic system which has a monthly subscription and then a per VFD fee to them. It will take time for them to do this. If it's a veterinarian that you've never worked with before, they're going to have to either examine your animals or come to your place. There's legal requirements under their license for them to establish that veterinary client-patient relationship. So if you've never worked with them, there may be a call charge, and hopefully you get some good out of that. They can give you some pointers and help you with some health things. If they're one you've worked with and they've been out to your place, there might just be a fee for their time and costs involved, and your veterinarian will decide what that's going to be and let you know. It's not going to be like hundreds of dollars. I mean, it's
right.
Yeah.
We've got another question from the audience. Is there a way the chlorotetracycline will be approved in the future for use in treating foot rot or pink eye? Will that off-label use be corrected at all in the future, that you think?
Well, so here's the realities of that. There's two documents which are the major hurdles. They're called Guidance for Industry 152 and Guidance for Industry 159. G152 is a qualitative risk assessment of the potential for an antibiotic to be used in food animals and then pass through the food chain to cause a resistant infection in people. The second is one where they evaluate how residues left in the meat, which can still be there even after the withdrawal time, they're just below the tolerance, how those might affect our bacteria in our gut, which, by the way, outnumber our body cells by a huge amount, and how that might lead a resistant salmonella. And you know, the salmonella Dublin you're reading about that was in, that's been affecting some of those calves, some of them 4-H calves. We look at how that would affect those. There are probably around 1,200 different identified genes which code for resistance to the tetracyclines. And those are present on something called a plasmid, which is very, very easily transferred between bacteria, and which often encodes or contains genes that encode resistance to a lot of other antibiotics. So when you look at that, the potential to work through those documents successfully, which would be required to add new approvals to those labels, if it could be successfully done, would probably take multiple years and millions of dollars worth of studies. And you would have to do new efficacy studies and would probably have to redo some environmental statements, and would also have to probably redo an analytical method for regulatory purposes. And you're probably looking at close to $10 million in 5 to 7 years to get that done, to add those labels. Those are generic products with high volume, low margins, and so that's a fancy way of saying no. I don't think that's going to happen. Unfortunately, we've asked the FDA Center for Veterinary Medicine for some help on this, telling them this has been pretty important to us for some pasture pink eye outbreaks and foot rot, and the efficacy can vary, but people have used them, and they're not really willing to back off the extra label use ban for just those specific uses. We're working on that. We may be able to get some relief, but I would not expect the pharmaceutical company to pursue those additions to the label.
Okay. I'll give the audience one last chance to ask any burning questions you have. We do have one other question. Do you predict, higher than average farm visits once this goes into place? Will this mainly be regulated through veterinarians, or do you see any more involvement with the USDA and producers?
So what will happen is the ones that will be doing their primary inspection will be that the FDA will contract with your state feed inspectors who inspect the feed mills, which all have a state feed mill license, and the distributors. So they'll go inspect those, and they'll pick out 3 veterinary feed directives, and they will choose one to follow back to the producer and to the veterinarian. That's the way the routine inspections will go. If someone has a problem with a residue, that could be an FDA inspector or a state inspector from the FDA that comes by. The state inspector contracted to the FDA.
Okay.
They don't have the people to just go out and do blanket, widespread check every farm and see what they're using and doing. I don't expect a lot more visits. It's a pretty rare chance that you would be inspected, but it sure could happen. They have written into the rule is that FDA has the legal authority to ask you to produce those VFDs and records on how it was used. So.
Okay, thank you. Well, I think in the interest in time, we've got a few other questions, but I guess, well, what are your thoughts, Dr. Apley? You want to take one more?
I'm good for as long as you go.
All right. So we had one question about whether or not we'd have the PowerPoint, and I think you said at the beginning that you would make your PowerPoint available to us. If you just email that to us, we'll make sure that everybody in this group has access to it. The other question we had is how is the regulation or the registration for the feed stores going to work? Is that an option that feed stores go through? Is it required? Are you going to have to hunt down a provider,
what the feed mill will do is they will send a letter to the FDA saying we're going to be a feed distributor, a VFD drug distributor. They will be on a list that anyone can access on the FDA website. And then any feed they buy to resell, they have to send a letter of acknowledgement to that provider saying they will only sell it to someone who has a VFD, and then they will have to collect VFDs from anyone who comes to purchase. So they have a three-way document trail, one receiving and two sending. And that's what it takes. It's 2 letters and then collecting the VFDs. So I think a lot of feed distributors are fully intending to do that, but it's a little bit more of a process to get registered to receive the prescriptions, and a lot more paperwork, and I don't know how many are going to retain the water-soluble versions. But
perfect. Well, on behalf of the SPC collective group, I want to thank you. What a great talk, and it's an honor to have somebody with your expertise to address our group. It's really, we appreciate you taking time out of your busy schedule to talk to us tonight.
You're welcome. I even had time to get a ribeye munch before we started. I might go see if they have dessert. So.
All right. Well, thank you, Dr. Apley.
Good luck to all. Thanks for having me.
Thank you.
Bye.
Goodbye. Okay, so before everybody else leaves, we've got a brief update from Chip on the steers in the yard. Chip, you want to tell us about your conversations with Chapel?
Sure, but before I do that, I would just kind of like to reiterate sort of what was just alluded to. If you're one of the young folks on this phone call, I would encourage you highly that when this talk gets posted, take the time. Grab your folks, grab your friends, your 4-H people, your FFA advisor. I hope you realize how fortunate you are. There are not very many folks, period, adult, junior members, regardless of your status. There are not many folks who get the privilege to listen to one of the leading experts on one of the most hot topics going. So I encourage you to follow up on that and listen to it again. I know I will. I'll just be brief because the yard says things are going quite well. From what Emily and I have been informed, minimal health issues to this point. Only a handful of calves have had to be pulled and been treated. Likely some of you may have recognized those on bills that you have received or will soon receive. But for the most part, my correspondence has been very positive. They said the weather, much like some of us were discussing before the phone call, the weather out there has really started taking a turn, and the calves seem to be handling it well. The feed yard really at this point has no concerns. They feel quite confident where your calves are at. They've actually commented to me through a couple different emails how impressed they are just in terms of the general health of the group. And so that's really, for the most part, all to tell you things are going well, and we appreciate what you all did early on in terms of prepping those calves for that transition.
Great. Thank you, Chip. Emily, are you still there?
I am still here, yes.
All right. Any announcements you want to give to the group?
No, the only thing that I would send a friendly reminder about is if you have not sent me your filled out insurance form for your steers, I would ask that you please do that when you send in your write-up on this webinar. Like many of you know, Chip, and if you haven't heard or couldn't remember, Chip worked very hard with an insurance company and was able to get insurance on our steers, which is a pretty tough thing to do with feedlot steers. And so we were able to get that, but we do need those forms back from each of you. And I know there's quite a few of you that have not sent in your insurance forms. Let's hope and pray we never have to use them, but in the instance it's needed, we're going to like to have them on file. So when you guys send in your write-up this week, if you will send me your insurance forms, I believe that's all I've got on my update. And like Chip said, you should have, if everybody has not received at least one bill by now, do let me know, because I believe they said that they have now sent out 2 bills. And so if you haven't got 2 bills in the mail yet, look for it this week. And if you haven't received any bills, then please let me know. And that way we can make sure that the paperwork on our end is right. So I think that is all of the updates that I have, unless, Jackie, you have anything else?
Can I follow up on one thing there?
Sure.
I just want to be completely clear and to be the blunt and rude one of the group. Should something unfortunately happen to your calf and it perishes, if you do not have an insurance form on file, you will not receive that compensation. So that's incumbent upon you to fill out that form. If in case that happens, that burden is on you.
Yeah, and I just had a couple of updates. We've got all of our DNA on all the calves has been sent to the ASA, so we'll get that organized and off to GeneSeek soon. Thank you to everybody for sending the DNA in. I also wanted to mention reading through the summaries from last month's speaker, Dr. Susan Keller. I was really impressed with how well everybody did on a pretty complicated subject matter in pulling out information. You know, we don't expect everybody to understand all 50 minutes or whatever it is of these presentations, but the big point is to take away some message, is to learn something every time, and apply that to the way that you do your business. So it's also a difficult task on the speakers to develop talks for, you know, age ranges from 8 to 21. But I was really impressed with the summaries that everybody put together. So thank you. Keep up the good work, and get your summaries in from this week's talk by next Tuesday.
Yep. And we will talk to everyone. Our next webinar is Tuesday, January 3rd. We'll hear from Dr. Matt Spangler of the University of Nebraska, and he is going to talk on using EPD indexes to produce more profitable beef cattle, more profitable feedlot cattle. And so it'll be a great talk, and I know in the next 12 months, some of you will have calves hitting the ground for next year's SPC contest. So something to look forward to. We will talk to all of you on Tuesday, January 3rd.
Okay, well, I think that's it from us. Thank you, everybody, and we'll talk to you soon.